Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Which of the following conditions does not present with both which of the following condition does not present with both Mullerian and Wolffian duct structures? So that means which of the following condition does not present with both Wolffian and Mullerian duct structures? It is FSH receptor mutation. What happens in FSH receptor mutation? In case of FSH receptor mutation, the Mullerian ducts will develop normally. And the problem is here is FSH cannot bind to its receptor. So the patient will have primary and secondary amenorrhea will be there. And there will be variable secondary sexual characters will be there. And there will be high levels of FSH and LH. And here only Mullerian duct would be present as the patient is female. So here only Mullerian duct will be present as the patient is female in FSH receptor mutation. Okay. Then if you see in the case of anti-Mullerian hormone deficiency, in anti-Mullerian hormone deficiency, this is also called as persistent Mullerian duct syndrome. This is actually the karyotype is 46XY because it is Y chromosome is present on the gonads. So the gonads will be the testes. So there will be Sertoli cells. In this syndrome, the Sertoli cells fail to secrete Mullerian inhibiting hormone. So in these patients, both Mullerian duct will be present and Wolffian duct will also be present. Then if you see ovotestis syndrome is true hermaphroditism. In true hermaphroditism, both ovaries will be present and testes will be present. Then we have mixed gonadal dysgenesis. Mixed gonadal dysgenesis, here the karyotype will be 45XO and 46XY. So because there is a Y component, obviously there will be testis will be there, and on one side and on the other side there will be streak ovary will be there because it is like Turner's variant. So you will see one side there will be streak ovary, on one side there will be testis. So Mullerian duct and Wolffian duct will also be seen based on the sides. That means in the streak gonad, if streak gonad on one side, on that side you will see ipsilateral Mullerian duct will be there. On the side where testis is present, on that side you will see formation of ipsilateral Wolffian duct will be there. But FSH, but so you will see both Wolffian and Mullerian duct structures are also seen in mixed gonadal dysgenesis.
thank you and thank you for watching.